Hello, everyone. I'm Jana Moore with Epilepsy Support Network of Orange County, and I'm going to help facilitate Dr. Mehta. And we want to welcome you all to Orange County, where Epilepsy Awareness Day is. Unfortunately, we're not meeting in person this year, but it's okay. We're virtual, and we continue to stand together as one and bring the epilepsy community together, thanks to Brad and Candy and Sophie from Epilepsy Awareness Day. We are so thankful to them. And our speaker is Dr. Mehta, and Dr. Mehta is with HOAG Hospital Epilepsy Center, and it is a level 4 epilepsy center. We boast 4 epilepsy centers in Orange County. We're very proud of them. And they do spectacular work for the members that we refer to them, and we count on them for their good work. We can't thank them enough. And Dr. Mehta has performed neurosurgery on many of our members that we've referred to HOAG in Orange County and from, around the state and even further. So without further ado, Dr. Mehta, take it away and share your knowledge with people from beyond Southern California. This is a great joy to be able to share information with our nation and internationally. We had someone from India on the last Zoom. So thank you for being here, Dr. Mehta.
Oh, thanks so much, Jenna, for that intro. It's great to be here with all of you. Treating patients with epilepsy is really my passion, and along with Dr. Millett at HOAG, we've made a priority to do our best to optimize the care of patients, provide all of the different treatment options to treat the most complex type of seizure disorders. For my session, I thought instead of giving people a talk about the different techniques in epilepsy surgery, I would invite 2 of our former patients, Stefan and Natalia, who had surgery with us. And I thought I would do sort of a Q&A and facilitate a discussion with them. So the people out there, patients, families, can hear from actual patients themselves about their experience and what their thoughts were. As physicians, we do our best to try to put ourselves in the shoes of our patients and understand how they would make a treatment option or make a decision, what they go through. But there's really no substitute for speaking to the person who's actually going through it and getting their perspective. So if I could introduce Stefan and Natalia. I see you guys both there. It's good to see you. It's been a long time.
Yeah, thank you for having me.
Yeah, hi, doctor.
Good to see you both.
Oh, yeah,
so, maybe we can start off by if each one of you want to take maybe a few moments or as much time as you need to tell us a little bit about your epilepsy history, whatever you feel comfortable sharing, and how it is you first came about learning that you were having seizures, and how you eventually got to an epilepsy center. Stefan, do you want to start?
Sure. So my name is Stefan. I'm 29. When I started having seizures around 12 or 13 years old, and they thought that maybe it was like part of puberty, and that it was just my body going through changes, and that it wasn't really like a neurology type thing, and that my body was just like going through changes and dealing with puberty, basically. So I started off having like about 8 seizures a year, and I started off with Keppra, and I was on Keppra for a long time. I just got off Keppra and started taking different drugs. After Keppra, once I started taking Keppra, my seizures were controlled, and for the most part, and occasionally I'd have a seizure like 2 times a year, maybe, like if I missed my medication, or even when I was on meds, I would still have them sometimes. And I was having auras sometimes too, but I was still having like full-blown seizures where I would like lose consciousness and basically not know anything. I'd wake up in the hospital, and I'd be out for an hour, or and even when I wake up in the hospital, people would think I was like from a different country, because I wouldn't be able to communicate with them, and they would try to ask me questions, and I was like speaking gibberish, and they wouldn't be able to communicate with me at all. And eventually I would come to and be able to tell them my name and stuff. And this was controlled for a while, other than like the 1 or 2 a year. And then about a year and a half ago, I started a new job where I was working on the railroad. And when I was working on the railroad, you work like weird hours, and I was basically working graveyards where I would start at like 2 in the morning, and I'd get off at like 2 in the afternoon. And that's when my seizures were like no longer controlled, and I started having these full-blown seizures again, where I would lose consciousness and stuff, and I was having like a lot of them, from like to where it was controlled. Like I'd have like 1 or so to where I was having like 20, like a lot of seizures. And I would also have the auras too, where I felt like I was going to have a seizure, but then it wouldn't happen. And so eventually I saw Dr. Park, and he's out of Newport Beach, or he's out of Irvine. And then I got to meet Dr. Mehta after that, to where I was in the hospital for a week, and they got to like monitor me, where I had like all these things on my head, and they were able to locate exactly where the seizures were coming from. And then I had surgery with Dr. Mehta, and last November, it'll be a year on November 15th. And I haven't had any auras or any seizures since then. I felt like a little out of it, and for like a month afterwards. But other than that, no issues, no seizures. And I'm very thankful for Dr. Park and Dr. Mehta, and they changed my life, and I'm happy to be here. And it's been amazing.
Thanks, Stefan. That was really great.
Yeah.
So from the time your seizure started until you considered surgery, how many years went by?
So I started having seizures at like 12, 13, and then I had surgery at like 28. Yeah, 28, because I turned 29 in September.
Yeah, which is not unusual. Most patients for years are on medications, either well controlled or not well controlled, but your situation is not unusual. Now, if you are able to be controlled on medications, that's great. And about 2/3 of patients can be controlled with medication alone. But for the remaining 1/3, the option is to be referred to an epilepsy center for evaluation. So we'll get more into that. Natalia, do you want to share your story?
Oh yeah, I can share. It happened with me. Let's see, a year and a half ago, I believe, because I don't know, maybe it happened with me a little bit earlier, but maybe I didn't pay attention to that. But year and a half ago, I started to experience like severe seizures. And the first time I didn't understand that it's seizures, like something happened with me. Like I received money. I was working as a cashier, and I can't count. I don't understand what this money means, like how to count it. And I like, oh my, people ask my name and I forgot my name. I'm driving. I see a light and I don't understand. I see green all cars coming, but I don't understand. Should I go or should I stop? What does it mean? It was crazy, and I had like deja vu when I first meet person tells some personal stories, and I feel like, oh, I know what happens next. I know the story, and I at first I thought, oh, maybe I have like some special, I don't know, spiritual power, but it happens like more and more often with me, and I start looking for a doctor. I need help because it's not okay when I can't speak. Like people come to me with some conversation, I start conversation, and then I can't speak. I lost ability to speak. I just freeze, and I understand that something happened with me, but I can't push myself to speak. Like I just freeze for a minute, or I don't know how long. Yeah, and I end up with Dr. Park also in Irvine, and he confirmed that I have an epilepsy. He prescribed me some pills. I started taking these pills. I don't really remember the names of these pills, but it actually like not happened to me, not helped me like 100%. I had like less seizures than before, but still I had these seizures. And then Dr. Park referred me to Dr. Mehta, and yeah, in a month after meeting with Dr. Mehta, I had a surgery. Yeah, and after surgery in a week, I believe, I was like happy dancing. I was free of seizures. I felt well. Yeah, it's a great experience. Yeah, if I call this great experience. Yeah.
So thank you, Natalia. That was great. Um, so when you first found out that surgery was recommended, what were your feelings? What did you think?
I don't know. I didn't have any like I wasn't scary. I just want my life back. I was scared with situation in which I'm now with the seizures, and I like, okay, if it can help me, let's do it. And I don't know, you were so confident after I met with you in your office. I didn't have any questions. I was okay, ready to go.
Stefan, how did you feel when you heard that surgery was an option? Were you scared? Were you considering staying on the medications? I mean, surgery can be a very scary thing.
So I forgot to mention that like after Keppra, like Dr. Park tried different medications, and they didn't work either. So like my seizures continued. So I was totally up for surgery, especially after we met you and you played this video, and you came off like really confident in like how simple it was, and that the recovery was like one day basically. And after we met you and you explained it, I felt like it was an awesome option. So I felt great after our meeting, and I was totally up for it.
But you both had different types of surgeries. Stefan, if you want to talk about a little bit about what you had done and what your recovery from that was like.
So I had laser ablation surgery, like on my left side, and I went in on a Friday, and I left on a Saturday, and I went back to school on a Monday, and it was very simple. The recovery, like I was kind of like a little bit out of it, but as far as recovery time, like I was out of the hospital the next, like by noon the next day.
And Natalia, what kind of, you want to talk a little bit about your surgery and what your recovery was like, and you had something a little bit different.
Oh yeah. I believe it's left temple. It calls temple, yeah, left temple. I remember I used to have like extremely long hair, and my question was to Dr. Mehta, "Oh, are you gonna shave me?" And he like, "Oh no, don't worry, just a little." Yeah. Uh, right after surgery, my friends visit me, and they were surprised. I was so energetic. I talked too much, too much, I believe, and they're like, "Did you have actually surgery or how?" Yeah, and I also had surgery on Friday, and I was discharged on Sunday. Yeah, in 2 days. It was easy recovery for me, and I was surprised. Like it's brain surgery. It's like yeah, but in a week I was like completely fine, like completely fine, full of energy, full of like life energy. Yeah.
That's great. How was the pain?
Ah, I don't remember. I didn't have any. No, I had like first day. Yeah, I had like huge headaches. Yeah, severe headaches. I even couldn't speak because it was so painful. And I remember in the hospital they provide me pills, new pills, like yeah.
Yeah,
But after one day, yeah, on Sunday, on Sunday evening, in 2 days it was gone, I believe.
now, can people tell, for both of you, can people tell that you've had a brain surgery for epilepsy? Does anyone see the scar, or does anyone notice?
Not
No.
at all. You can't tell at all. It's crazy.
Yeah,
Like
that's
the hair covers it totally. You can't feel it. You would never know.
yeah, that's great. So, and have you either of you met patients now, or run into people who have seizures, or are you have you been involved in talking to any patients? I think my office may have set you up with some people, and what has that experience been like?
I talked to one person. I don't remember their name, but somebody that was going to have a similar surgery. Your office set me up to kind of explain my experience to them, probably just to make them feel comfortable. And I told them my experience and that there's really nothing to worry about, and that I've been seizure free, and that they have a great doctor, and that they should feel confident.
Great. What we can take a few minutes. There's about 22 people on. Does anyone from the audience have questions? They can either unmute themselves and ask, or they can type it in the chat box. Give a few minutes, a few seconds to see if anyone wants to ask a question.
Hi, this is Tom Anderson. My son is Mark. Similar to Stefan, he had seizures starting at 14. And hi, Jenna. And has experienced seizures now. He's 44, so 30 years. We've had 5 workups. None of them produced some evidence, but all of it was negative. And so he did not qualify for surgical procedure. He's been on most of the implants with VNS and those types of things that really have not worked, failed most of the medications. And
I would say they tried almost all kind of testing, like had the implant electrodes. And if any of you know what a MEG test is, I've tried that, and they've always come up negative with no answer on it. Because they've told me that my kind of seizures are the case where the start of the seizure is just too deep, and I never spark any kind of get any spark to show any information on any of the testing. So I've never been able to qualify for testing.
So I guess our question would be with the new, he hasn't had the new electrodes yet, which are the real thin ones. And we are considering going through that process again. We know that more electrodes can be placed because of it. His seizures come from the temporal lobe, frontal lobe, I mean.
And I have grand mal seizures.
He has grand mals, and he's having, over the last couple of years, many more seizures that are awake and no or and just collapse.
Mine start in just seconds, so I've always fallen and had the injury.
So anyway, the question would be, does it make sense maybe to try the new electrodes to see if more of them planted could give us an opportunity to catch something that we haven't had before with all the other procedures? And if so, is an ablation something that might benefit them if they can actually pinpoint the spot?
Well, for me, do you want me to talk or did you want to talk?
Sure, go ahead. Yes.
Okay. For me, they couldn't really pinpoint it. They just knew that I was having seizures because, like Thomas, I would wake up or I'd be like watching TV in the living room or whatever, and I'd like stiffen up and fall I would basically have a seizure, and they would never know why. So I had this like crown, and I was in the hospital for a week, and I would sleep there, like a a whole week. And the first day I had like one small one where I didn't lose consciousness, and then I had one where I did lose consciousness. I didn't even know that I lost consciousness, like Thomas. But they told me the next morning that I did, and then the rest of the week I didn't have any. And they were going to slowly wean me off my medication, but I ended up having one on the first day, and then I didn't have any the rest of the week. So maybe if you could do something like that, they could pinpoint the area better.
Yeah, what would you say is the best way to figure out though? Because my case also is that since they happen so quickly, even if I had a seizure during any testing, my seizure, they could never find the focal point because I would have a seizure and it just spreads all over the head in moments, so they can't really come up with the real area to do any surgery for.
Thomas, have they ever implanted electrodes in your brain to try to find seizure focus?
Yes.
I've had that before, and we're just wondering if we should try that again, because we were told that maybe the first ones were just not a good enough quality or technology. Because we did it like 6 years ago.
6 years ago. Okay.
Maybe,
now, were those electrodes put on the surface of the brain or actually into the brain themselves?
They were surgically. Yeah, they were surgically put in the head.
Yeah,
I think.
Yeah, there are some newer techniques to try to better localize the seizure focus. It seems like you've had a lot of the good workup done, the MEG, the phase 2, what we call the invasive EEG monitoring, where we place electrodes in the brain.
Right.
We're happy to see you. I assume, were you seen at a level 4 epilepsy center?
Pardon me?
What we've seen out of an epilepsy.
Yeah, we're currently with Dr. Millett out of HOAG.
Yes.
Okay. So yeah, we can, I think to answer your question, and also maybe what other people may be wondering is, if we cannot find where the seizures are coming from, you've had one study, EEG monitoring, and it doesn't explain should a second study be performed. And what I would say is that decision is not easy to make.
Right.
We, in our center, present the case in our epilepsy conference where experts from neuroradiology, neurosurgery, neurology, epilepsy neurology, all discuss the case. So I think being in a center where there's a group of people who's going to look at your case and do a thorough workup and make the appropriate recommendation is very important. The deeper electrodes do often find the seizure focus. We have to make sure that it's appropriate to do that surgery. But to answer your question, yes, sometimes the deeper electrodes are helpful in finding the focus.
And these are the new, they're very thin, aren't they? They're almost like a thin wire.
Yeah, the depth electrodes, what we call stereo EEG or depth electrodes.
Yeah.
It's much easier than an open craniotomy. We actually don't have to cut a piece of bone open to get a window to the brain. These are just made through little pinpoint incisions through the scalp. So yeah.
Yeah.
Is that also true? Because they've said sometimes that the electrodes were just maybe a tiny bit off and they just didn't catch the spot.
Yeah, that is possible.
Right.
Yeah, that is possible.
Yeah, our last workup was at UCI with Dr. Lin, and inconclusive there as well. We've had 3 at HOAG and 1 at UCLA over the 30 years. So anyway,
Yeah.
thank you.
Thank you very much.
We've got a few questions on the chat box. Cindy is asking, Stefan or Natalia, can you tell us about what happened to your seizure medications after surgery?
So I still take medication. I take zonisamide and something else. And then to Melody. Laser ablation, instead of like cutting like my whole scalp open and like removing the area of the brain that is having seizures, they go in with like a laser and burn the area that's having seizures and they leave it in there. Dr. Mehta can probably do a way better job of explaining it than me, but that's like the non-doctor way of explaining it.
Yeah, I can explain that in detail. Natalia, how did you continue on medications after surgery? Is that right?
Yeah, after surgery, I had surgery a year ago in August, and I was taking medication until March this year. It's like almost a year. How long it was? Like, yeah, almost a year after surgery. And then I met with Dr. Park. We did additional EEG test. And since surgery, I didn't have any seizures. And I didn't know because it was like a good job on surgery or because surgery with the pills. But on March, this year on March, I had additional EEG test, which comes like clear, no seizures. And we tried like to cut my pills. And since March, I without pills and I don't have any seizures. I don't have any more like these headaches, which was before together with my seizures. I had like severe headaches. Now anything. I don't have anything. Yeah, I'm free of pain. I'm free of scaredness. Yeah.
Great, thank you. So yeah, well, I'm glad we got that question. So one thing to keep in mind is after seizure surgery, most of the time you are going to continue on medications even after surgery for very likely 6 months to a year. And for many patients, you may still need to stay on medications for some time. In some patients, over time, we are able to reduce the dosage or change the type of medications, maybe to medications that have less side effects, and you'll work with your epilepsy neurologist on that. But one thing to keep in mind is very likely you will continue to take medications after surgery. Melody asked, can you explain exactly how ablation surgery works? So ablation surgery is a newer technique, maybe around for the last 7 or 8 years. What it replaces is having to do an open surgery where we cut out the piece of brain where the seizures are coming from. Instead, what we do is we place a laser fiber into that area, and under MRI guidance, meaning you're in the MRI machine, we heat up the laser and using heat from the laser, destroy the bad part of the brain that's causing the seizures. The advantage of laser ablation over some of the other techniques is that we can be very selective about how much of the bad part of the brain we want to destroy. and we don't cause any or very little damage as we get to that area. If the area is very superficial on the surface of the brain, surgery is a perfectly good option. But if the area is very deep in the brain and it's hard to get to, and it can cause a lot of side effects from the getting to that delicate part of the brain, then laser ablation may be a good option. It's also much easier on the patient. The incision is much smaller, about 1 to 2 millimeters in size. Maybe 1 day stay in the hospital. That's our average. Is you come in on Friday morning and you usually leave Saturday morning. That's very typical. All of our patients who've had epilepsy laser ablation go home in 1 day. So it's an easier recovery. It's minimally invasive. It's very targeted or very directed to the areas where the seizures are coming from. So those are the advantages. What are some potential drawbacks about laser ablation? One may be that the laser can only ablate a certain amount of tissue. There's a limit to the size of tissue that can be ablated by a laser. In certain cases, the area that needs to be treated may be bigger than what the laser can treat. So you may require several or more than one treatment, meaning you may have more than one incision, or you may need to come back for a second ablation. Other times, the seizures are just not coming from one spot. They're spreading from multiple areas. And in that case, laser ablation is usually not recommended or effective. So there's a very detailed workup that's done. And when we identify those patients who are good candidates for laser ablation, and we recommend it, there's usually a very good chance that we can significantly reduce the seizures or even stop the seizures altogether. So that's briefly about laser ablation. Let's see, I don't see any other questions on the chat box. Anyone out there have any questions? If you want to unmute yourself and ask either Stefan, Natalia, or I any questions?
Yes, Mr. Anderson. Again, the success rate, ablation versus a regular surgical procedures.
Yeah, so ablation is still relatively new, and there are ongoing trials to try to determine the effectiveness and also the side effects of laser ablation. The early data shows that it's almost as good as the open surgery, maybe not as good. The open surgery obviously is much more invasive, several more days in the hospital, but the seizure freedom rates may be higher with the open surgery. I think as we get better with the laser, meaning we know how to place the laser better, how to heat up the laser better, what structures to target, there's hope that the laser ablation will be as effective as the open surgery, but that's still being studied.
Okay.
All right, thank you.
Thank you.
So you kind of answered my question like a couple of seconds ago. So if you have multiple foci, it's not as good a technique. Like I've been on 17 different meds. I've had brain surgery. Last year I had the VNS put in March. So I guess I was kind of like wondering if it's jumping from one area to the other on both sides, front, back, sides of the brain, if laser ablation would be something that could possibly be another option.
Yeah, that's a great question. Thanks, Amanda. So laser ablation or any type of focal resection, whether you cut out a piece of the brain or you heat it up with a laser, it's very effective when the seizures are coming from one spot. When seizures are coming from multiple areas, those approaches generally are not effective. That's where things like responsive neurostimulation with the NeuroPace device or deep brain stimulation or vagal nerve stimulation are more effective?
What if one of the reasons that they're not able to get it is because it's so deep? Because it was when I was like 11 hours old, according to my mother, when my blood sugar and calcium dropped to 0, causing me to go into uncontrolled convulsions, and I was rushed to the children's hospital, etc., and was like in and out of status for 2 weeks. So that's what's caused the gray matter. So it's been like 36 and a half years pretty much. And that's why they couldn't go any deeper with surgery, because they couldn't get that deep. I was 19 when I had the surgery done, and they weren't able to get deep enough without causing complete blindness or more speech impairment.
Yeah, you know, I think that if the seizures are coming from one spot, and that spot is deep, laser ablation potentially could be a good option. If you're under the care of a neurologist who's familiar with that technique, it may be something to bring up to them. We certainly have a good experience with it. You can definitely reach out to our team and see if it's something we can look at your case in detail and see if you would be a candidate. There are many options. Now, when I think back, even 5 years ago, we didn't have deep brain stimulation. Responsive nerve stimulation was just coming on the market. Laser ablation was not really proven. Vagal nerve stimulation had been around for many years, but the newer devices were not out. Stereo EEG was around, but not very popular in the US. It has been very popular in Europe, but only recently has it become more popular in the US. So there have been a lot of developments over the last 5 years. The field has changed dramatically. So it may be worth, if you haven't been reevaluated at a high volume level 4 center, which has all the surgical options, it may be worth being seen at one of those places.
All right, I'm up in Canada, but we usually come down for the expo. And last year I got to see Rosa, who puts in all the devices.
Yeah. That's great. Thank you for your question.
Thank you.
Robert asks, is there an age minimum? So at HOAG, we are an adult epilepsy center. So generally 16 and up, we can treat. Under 16, they are doing laser ablation for children for a variety of different type of seizure disorders. I don't know what's the youngest patient who's had a laser ablation. We can probably find out from one of our pediatric colleagues who treats children, but I believe they are treating young children with laser ablation as well.
Would you consider HOAG to be a high volume epilepsy center?
Yeah, so the way epilepsy centers are graded is based on, it's a scoring system 1 through 4, 4 being a center that's high volume, meaning they're admitting a lot of patients to the epilepsy monitoring unit. They're doing a certain number of surgeries, there's certain surgical capabilities. So 4 is the highest number you can be. And HOAG is a level 4 center. So depending on where you are, it would be good to research what are the level 4 centers in your area. HOAG is a level 4 center.
Thank you.
Thank you.
Dr. Mehta, maybe it would be a good time to talk about all the wonderful virtues of a level 4 epilepsy center, specifically when it comes to surgery. So the attendees know what an epilepsy center offers and how your team gets to surgery.
Yeah, thanks, Anna. That's a great question. So seizures are very complex. And it takes a team of people, doctors, nurses, to figure out who is the right patient for surgery. Now, there are about, let's say there are about 3.5 million people in the United States with seizures. So there are quite a few people. And of those, maybe about 2 million people can be controlled with medications, and the rest are going to be treatment resistant to medication, meaning despite the best efforts to control their seizures with medications, patients continue to have seizures. So those patients should be referred to an epilepsy center. Unfortunately, very few of the patients who have seizures that are difficult to control are referred to an epilepsy center. So what happens in an epilepsy center? There's going to be a neurologist, a seizure doctor, who has special training in this field, meaning they've taken extra time, several years after their training, to specialize in the medical management and surgical management of patients with seizures. That includes finding out who is the appropriate candidate for surgery. Before we get to surgery, we want to make sure that patients are on the right doses and the right type of medications. Obviously, if we can control your seizures with medications, that's the best case scenario. So you want to make sure that the neurologist or the center you're at has someone who's specially trained and sees a lot of patients with epilepsy, so they have a lot of experience. In those cases where medications have not worked, there's a workup which includes a little bit about what Stefan mentioned, which is called a phase 1, which are electrodes on the scalp, and you are admitted to the hospital, and your seizure medications are either reduced or stopped to try to let you have a seizure. And when you have a seizure, those electrodes pick up where the seizures are coming from. We take that data and match it with your MRI data, and we try to figure out where in your brain are the seizures coming from. Oftentimes, that's enough data to say we now have an approach to treat your seizures with surgery. Now there's several options now for surgery. There's an open surgery where we remove the piece of the brain that's causing the seizures. There's different stimulation types like deep brain stimulation or responsive nerve stimulation or vagal nerve stimulation, all of which work in the same way that a pacemaker for the heart works. It senses the abnormal electrical activity and delivers a stimulation that's not painful, you don't feel it, and it tries to reset the brain waves to stop the seizures. There's also the laser ablation techniques we talked about. So once you have that phase 1 study done to try to localize the seizures, one of two things will happen. Either you will be recommended for a phase 2 surgery, which is where we actually, once you have the phase 1 study done, which is not a surgery, that's an admission to the hospital with scalp electrodes. So for those patients, one of two things will happen. You'll be recommended for the phase 2 surgery, which is where we put electrodes in the brain. There are two ways to place electrodes in the brain. You can make a window in the bone and place electrodes on the surface of the brain, or you can make tiny pinpoint holes and place small electrical wires or electrodes into the brain. Depending on what your MRI shows and the type of seizures you're having, you may be a better candidate for one or the other, and your neurologist and neurosurgeon will make that decision together. So getting back to Jana's question, what does a level 4 epilepsy center have? We talked about the neurologist, a specialist who's trained in treating patients with seizures. Then there's going to be a neurosurgeon, someone who is familiar with all of the different treatment options for seizure treatment. Vagal nerve stimulation, laser ablation, deep brain stimulation, stereo EEG, open craniotomy surgery. So you want to go to a place where all of the options are available. Each one of those options may be the perfect option for you. So you want to go to a place where all of those options are available. A very important piece of a level 4 epilepsy center is participation in a multidisciplinary epilepsy conference. This is where a team of neurologists, not just your neurologist, but several other neurologists, as well as a team of neurosurgeons and neuroradiologists will look at your case and make recommendations on what they think is the best treatment option. It is very good to have multiple eyes on the problem, have different people looking at the MRI, at the EEG, at the seizure history, and making recommendations on what is the best treatment. Very often, we get a consensus, meaning everyone looks at the data and makes the same recommendation. That tells us that we're giving you the best possible option. A lot of times, there's some debate on what to do. Different people with different experiences will give different input on the workup or the surgery. And I think that drives a lot of discussion and debate, and it makes us really think about what we're going to do. After all, this is your brain. What we're doing is potentially permanent, and we don't want to rush into any decision, and we want opinion of several other people before we do anything. So that's another piece of the level 4 epilepsy center. If you do end up going for surgery, you want to make sure that all the equipment is available, robotic equipment, MRI technology, neuroradiologists who are specially trained in looking at scans of patients with seizures. And then you want to make sure that the nursing in the hospital is equipped to treat patients with seizures. There are special protocols for patients who are admitted to the hospital after electrodes have been placed in their brain. Oftentimes, patients are in the hospital for several days or even up to 2 weeks. So that's a very critical time to try to determine what's happening with the seizures. The nurses are really going to be the ones who are with you the majority of that time. So you want to make sure that the hospital you're at has that specialized nursing care to take care of you. So a level 4 center, in summary, is a center with a group of people who are specially trained in focusing just on epilepsy.
Thank you, Dr. Mehta. At the Epilepsy Support Network, we are patient advocates, and we do understand that less than, and correct me if I'm wrong, 50% of people who could be greatly improved by neurosurgery are getting access to epilepsy centers and neurosurgery. And we feel that time is of the essence. So we feel our job in collaboration with the epilepsy centers is to move them forward quickly to this option if it's available for them, so that we can diminish the amount of seizures that are affecting the brain. We can diminish hospitalizations and emergency room visits and quickly get them to this treatment if it is possible. And so what we do is every month we host an Epilepsy 101 where we discuss surgery with our new folks who come in, so that if that's where they're going, they've already learned about it, learned about epilepsy centers. And we are that extra level of safety and cautionary advocacy, because we refer to level 4 epilepsy centers, and we have worked with the hospitals for years. The Anderson family, we keep referring them to level 4 epilepsy centers, and they keep trying. And one day they're going to be able to have a successful surgery encounter because we make so much progress. But what we do is we make sure that the surgery consultation evaluations are being done at level 4 epilepsy centers with epileptologists and with a specialized team. And so we work together to bring them up to speed on all the information, to handhold them through it, walk them through it, because we know that the average adult may wait 19 years before they actually get to neurosurgery. Our pediatric patients, we can help the parents get to surgery in a year to 2 years, even sooner if it's an emergency situation. by just being with them during this process, because it can be daunting. But with your two wonderful surgical candidates here, they are a great example of how, you know, really easy surgery has become. We have come a long way, folks, and this is really, really wonderful. So I put the number up on the chat. If you haven't, if you don't know chat, put your cursor down to the bottom of your screen and it'll say chat. And then click on chat and you will be able to open the chat, and it says HOAG Epilepsy Center, the contact information, and our contact information, and we can get you to a level 4 epilepsy center. We're in Orange County. We prefer our epilepsy centers because we have great relationships and trust and great outcomes. But if you can't get to our epilepsy centers, then we will try to find a level 4 epilepsy center where you are. So please utilize those numbers. Time is of the essence. Don't wait. Epilepsy surgery has come a long way. We have an epilepsy surgery night for our members every year, because we are such big proponents on epilepsy surgery. We have seen lives changed forever. So contact us if you want information, and we'll get you in touch with Dr. Mehta's team. That's why we're here. And if you have any questions, if you have any other questions, we still have a few minutes for Dr. Mehta and about the wonderful work that he's doing. But we are here to help, and the information is on the chat.
Thank you, Jenna. Stefan and Natalia, I can't thank you enough for participating. When patients hear from you, it makes all the difference. They trust you. They trust someone who's been through it. They can see how you're doing. They can look at you. They can see what kind of scar you have. They trust you, and so your voice, your story is so powerful to help patients who may be struggling with trying to figure out how to control their seizures, or if they have fears about epilepsy surgery. If they can talk to you, it really makes a huge difference. So we can't thank you enough for participating. The sad part is, after I operate, I generally see you once or twice and I don't get to see you again. It's so good to see both of you doing well. Thank you.
Of course, thank you.
Do we have any other questions for Dr. Mehta or Stefan or Natalia? Again, the information is in the chat. We want to thank our very brave epilepsy advocates, and I want to congratulate you on your bravery to move forward with epilepsy surgery. And it's so great that you had the option to do that. And I want to thank Dr. Mehta for taking such wonderful care of the patients in Orange County and beyond. We're all in this epilepsy advocacy world together, and together, united, we can make so much more progress quickly. I always tell people that when they call is, we're going to catapult you through this process and get you the care that you need as quickly as possible. And we can only do that when we're working together. So I want to thank all of you.
Thanks, everyone.
Thank you.
Thank you very much.
Thank you, Jenna.
Thank you, Jenna.
You're welcome.
Thanks.
Good to see you.
You too.
Take care.
Yes, you too.
Thank you very
We'll
much.
do this. We'll win this. We'll keep going, okay?
Hopefully.
Stay strong, Anderson family.
Will do. You too.
Okay. I'm going to look up the next presenter. Let's see who it is. Okay, in 5 minutes, it's going to be Let's see. It's going to be Steve Tullius from ACP Center for Health and Human Potential. Structure affects function, structural consideration in the evaluation and management of epilepsy. So you get a 5-minute break. And then if you stay on, Dr. Tullius should pop up, and then he will take it away. Okay. And again, if you go over to chat, you will have Dr. Mehta's information at HOAG Hospital and our information at Epilepsy Support Network. And we are happy to help you get to epilepsy centers. And we have 4 epilepsy centers in Orange County, and probably we have 20 in the state of California. We're from Southern California. And we want all of our members going to epilepsy centers because it is the best possible option for improved care. Okay, I'm going to sign off. Does anyone have any questions before I sign off for the next speaker? Okay, we will see you. And on November 13th, we're going to have Talk to the Doc, which is going to be our signature program for Orange County, but everyone's able to attend. And we're going to have chat rooms like this, but we're going to have a 3-panel speaker, and we're going to have chat rooms so you can talk to the docs. So you'll be receiving an email very soon. If you're not on our email list, then email me at info@esnoc.org. We'll get you on the email list, and you'll get an invitation to our Talk to the Doc program, which is our annual November Epilepsy Awareness Month program. And it'll be from 6 to 8 p.m. on Zoom. And don't forget, happy Epilepsy Awareness Month, and wear your ribbon.